We'll go ahead and get started. First thing I want to do is, well, second thing, I want to thank you guys for being here, but I want to introduce Pat Richards. It's been my pleasure to know Pat for 4 months now. I first met her back in December. And we spent about 2 hours together in a board meeting. And when I walked out of that board meeting, I called my wife and I said, I just met the most amazing lady. It's not very often that you walk into a board meeting with a CEO of a large corporation and you feel welcomed and you feel comfortable the whole time. And the whole time we sat and chatted, I felt like, because she actually came in and sat down next to me during this meeting, and I felt like we've known each other our whole lives. So it's a thrill to introduce you guys to Pat Richards. She is the CEO of Select Health, which is probably the largest insurer in the state of Utah. My favorite thing about her is she's the chair of the Federal Reserve Board branch in Salt Lake City. And being a microeconomist, I studied economics in college and I love it. It's just so cool to have her and Park in the same room. So we're
Do you feel the energy? Do you feel the dollars?
Yeah, so we're gonna sit down, we're gonna have a chat, we're gonna talk to her about her experiences and how she got to be who she is and how she's now one of my favorite mentors. And hopefully, and we'll have time at the end of it. I don't have a watch on, so somebody needs to flag me down about 3:45, and we'll throw some question and answer that to you guys, because I think you're gonna fall in love with her kind of like I did. So,
oh my gosh, can you hear okay? Is this on?
Hey Rob, will you grab my black notebook back there? It has my question list on it. I used to be a Boy Scout and I was prepared. Not so much of a Boy Scout anymore. I know, squeaky shoes. I've had it all day here. Thank you, sir. Let's have a seat.
All right. So, first of all, I would really like to thank Chip and the Chamber and everyone here today for coming out. I'm really honored to be here and really delighted to spend some time with you. You said your daughter was coming too from school, right?
She didn't make it. They're getting too close to the finals. She's also a political science major with a minor in econ. And she was going to try and carpool about 20 people down there, but one of her econ professors sprung a project on them that has to be done tomorrow, so none of them are coming.
Okay.
So.
Well, that next time perhaps, but again, thank you for hosting this today.
I want to, by introduction, I want to tell you a little bit about how I got to know Pat. The Chamber of Commerce found out 7 months ago about some changes in insurance law. And we became very actively engaged in trying to find affordable solutions to help small businesses to be able to insure their employees. And we went out looking, and we found a group that was innovative and creative and really wanted to do something to reduce the cost of healthcare. And we found it through Pat. And we've been working with her since first week of December. And we've just enjoyed the camaraderie. We've been working with her and Porter Talbot from Elevate Insurance. And we're really excited about the opportunity of making some changes and doing some things that nobody's ever done in the insurance industry. And some of you have heard me promising that we're going to make an announcement. Well, because what we're doing has never been done in the state of Idaho before, it's taking longer than I think it should. But I promise you we're working really hard at this. So let's get started. Pat, can you tell me, or tell them, I've read your bio, can you tell our guests or our audience a little bit about your experience getting to where you are? I found it really intriguing to find that the CEO of a health insurance company was a nurse. So tell us about your journey and how you got to be who you are.
All right, well, thank you. Well, I am a nurse, but I would no longer be safe practicing because I graduated from nursing school back in 1974. That's probably before a few of you were even born. But always growing up, I had, well, the real reason I went into nursing, I'll just be very honest. When I was graduating from high school, I was talking to my dad, and my dad said to me, well, Patty, do you want to be a nurse or a teacher? That was it. at that time, thinking back at high school, 1970s, and I said, well, you know, little kids kind of make me nervous, so I don't want to be a teacher. And so I went to nursing school. And really, I will tell you one other thing about my dad. My dad, when I was in high school, made me go to summer school to take typing. And it was like, remember, did anybody take typing? Oh, good. Typing, because my dad said, you know, no matter what happens after you grow up and get married, and, you know, if something happens and you have to go back to work, you need typing as a skill. And so I sat in summer school and learned to type. Little did my dad know that now keyboarding, if you've got keyboarding skills, and I can actually type and talk at the same time, and you know, type something like 80 words a minute. But my dad had this wonderful foresight for the wrong reason, but it's great that I've got keyboarding skills. And I also followed my dad's advice and went to nursing school. And it was really one of the best things in my life. I went to nursing school in Wisconsin and learned so much, but it all started with this service ethic and this passion to serve other people. And after nursing school, my first job was at the University of Michigan Medical Center in Ann Arbor, and I worked there for about 5 years. And again, great experience. I worked on a critical care and trauma floor. And I was young at that time. You know, you have no fear at that age. And I got great experience. A little after that, did some normal things and was married, had a couple of children, and I took off work. I left the workforce for about 5 years, and during that time, went back to school. Undergraduate degree, and then I had other opportunities. That one of the best opportunities was I had a chance to work, when I was ready to go back to work. I wasn't ready to go back and work in critical care and trauma, but instead there was a job that was a Blue Cross plan in Ohio, and it said they were looking for what was called a utilization management coordinator. And in those days too, when I was looking for a job, I looked for the job in the newspaper classified ads, right? Again, we're talking pre-internet here. And I said, well, I don't know what this is, but the hours are 8 to 5, Monday through Friday, and whatever it is, with my 2 little babies at home, I said, I'll learn this job. So that was another pivotal point, and that's what got me into insurance. And they needed a nurse because, and you have to think of the context of the time. Blue Cross at that time in Ohio was doing something very innovative. And they were moving from the old sickness and accident insurance where they just covered services if you were admitted to the hospital. And they said, we're going to revolutionize healthcare financing. And we're going to start to cover outpatient services and preventive services and home care services and hospice services. And they wanted a nurse. So I had this opportunity, and that's how I started to learn about insurance. And it combined the health care, the insurance, and the service. And then it just kind of went on from there. And I've had really the privilege of working in a couple of great organizations. And right now I work for Select Health, which is part of the Intermountain Healthcare System based in Salt Lake. And with the insurance, the last thing I'll say, I know you have lots of questions, so I won't keep talking too long. But the one thing that I believe is so different having a nurse as the CEO of a health plan is, first of all, I have never forgotten my nursing care and the idea that we are here to serve other people. And the one thing that makes our plan different than other plans that have executives in suits, and I love them all, but to me, when somebody calls in, they're not a case number. They're not an ID number. They're not, and I hate this word, covered life. They're people. They're people that are calling us for help at a very vulnerable time in their life. And we have this wonderful culture. I inherited the culture, this wonderful culture of service. And so I've learned the business of insurance, but I've never forgotten the roots of being a nurse. So that's how I got to here. And that's why I'm just really thrilled to share some of this story today.
That makes a lot of sense. As I've met with Pat, and we've talked about insurance, I like to talk about plans. Pat talks about people. And now I understand why. Excuse me. So along the way, you've come a long way from working for an insurance company. What was it that inspired you to want to get into the leadership of the insurance company instead of just working there?
Yeah, thank you. When I was working as a nurse on the floor, I could make a difference in one patient and family at a time. And then I got into nursing leadership, nursing administration, and I could have a larger impact with the team and maybe the institution that I worked at. But now, kind of mixing that clinical background with the opportunity to shape policy. You know, we work really closely with state legislature, federal government, community leaders to shape insurance, come up with some creative things. Now the impact can be far greater. We can have an impact on the health of many more people. We can have an impact on the health of communities by working together. And our company doesn't work only for people where we cover the insurance. We work with community partners. We work with agencies. We work with, you know, a lot of health problems, if you will, aren't necessarily health problems. They're problems with access to food, transportation, housing, access to education, and that's something that the healthcare system cannot solve by themselves, but we would be foolish not to work with community partners. And so in many cases, we're as worried about making sure kids get vaccinated or that people get their preventive care, even if they're not our members, because we want the community to be healthy.
That's awesome, thank you. How many of you guys know Select Health? That's good, that's good. For those who don't know Select Health, can you share some of your, I call them wow statistics, some of the, you know, tell us about Select Health and what makes them big and special and why we should be, I don't know if I told you guys, Select Health's a member of our Chamber of Commerce, and they really do care about community. So we're pleased to have them as part of our Chamber of Commerce. But tell us what makes you special. What are some of those wow things about Select Health, other than the fact that you're the CEO?
Well, you know, that's, I'm so lucky. I get to work with 1,500 people. We employ about 1,500 people in several locations. We have a couple of offices in Salt Lake. We have an office up in Meridian. And I heard a rumor there might be an office here sometime, you know. But we have about 1,500 people, and I want to introduce you to David Lemperly, and I spent the day meeting with different people in the community. David is our Vice President and Chief Sales and Marketing Officer for Select Health. He joined us about a year ago, and we're working together up here today. But what makes Select Health special is the 1,500 people. I am like the luckiest person in the world because even before I joined the organization, there was a culture of service. There was a culture of caring, and it is the culture that makes us different. And I think some of the wow factors that might be behind that, we care deeply about our customers, but we care deeply about the people that work with us, and we call them caregivers, actually. Not that we provide direct care, but we always care about people. And we've been recognized now by Utah Business Magazine for 11 years as one of the best companies to work for in Utah. We've earned the J.D. Power Award for Best Customer Service in the Western region for health plan 8 years in a row. There's these other surveys that we do, Net Promoter Scores. We survey all the time because we want feedback because the world is changing very quickly and we can't keep up if we just sit and talk to ourselves. We have to listen to people, what they need, what the customers are. So we're surveying all the time. We're doing Net Promoter Scores, and we are, I think some of the, we get some of the highest ratings, whether it's insurance agents, whether it's doctors, whether it's anybody that we work with. So those are some of the wow pieces. And I think the other wow piece is we've been able to provide pretty stable premiums, the bills for insurance. One of the wow features, does anybody have, and don't answer if you want to keep anything confidential, does anybody either participate or know somebody who buys individual health insurance? And that's always been hard, because just a few years ago, if you had any conditions, you might not be able to buy insurance at any price. You know, I do have a lot of respect for the work that Your Health Idaho does. I think they do a nice job with communicating and getting the word out. But we know that insurance premiums for individuals have gone up. And this last year at Select Health, we are actually able to reduce our premiums for individuals by 2.7%. So that's probably a wow when you hear of a company that reduces something. And we are also able to hold our small employer rates more constant. You know, so I think that's maybe the most important thing. We're able to deliver great service at more predictable, and it's still too high, and it's still too unaffordable, and we're working closely with providers and others to make healthcare more affordable, but we are starting to see some of the efforts of this work to be tangible in what people are paying.
How many of you guys love the fact that when we ask her for wow statements about her organization, and she just gave us some really good ones, what was the first thing she said?
Culture.
Her people and the culture of her people. That's a tribute. That's a tribute to a good leader. I want to get into some business things because I see some friendly faces out there that are in the insurance business, and it's a highly regulated business that's difficult sometimes. How do you, as the leader of a large insurance organization, what are your goalposts? What do you do? How do you make the decision of what's best for your organization to keep moving forward when there's so much, I guess, structure and so many regulations trying to tell you to do something one way, and you're obviously an innovator and trying to do it a different way? What is your thought process when you're doing that?
Well, I think the thought process, and you're right, Chip, that these last 10 years, literally new regulations are coming out every day. And again, it goes back to the people, though. Fortunately, we've got a team of people that helps us keep up on the regulations. And we have an executive leadership team that works closely together. And when we make decisions about what we're going to do, where we're going to go, what we're going to offer, we make them as a team. And we make the best decisions possible. We have discussions about, well, what are the pros, what are the cons, what are the risks? But we have very open and honest communication, but it always starts back with our fundamental values. And we value, honesty, we value integrity, we value excellence, we value teamwork, and we look to say, what is our long-term objective? And we live by our mission. And our mission is to help people live the healthiest lives possible. So we start back to our mission, our vision, and our values, and then we align our decision-making against those. And we do spend a lot of time thinking things through. But then once we have looked at this, then we move forward and we execute, and we see how we're doing. We change course if needed. But it goes back to mission, vision, values, and again, having really great people that can speak honestly to each other. So we don't always make the best decision, but if we make a mistake, we own up to it and we change course.
Good advice. This is a question a lot of people don't like to answer, and I got this question approved before we came here, because some people don't like to talk about it. But what's the biggest mistake that you have made in business, and what did that experience teach you?
Yes, Chip did share with me some of the kind of questions he was going to ask, and I have to say that was the hardest one. And I thought about a couple, and then I thought, no, I'm not going to talk about those. But I do. I used to have a saying. I haven't used it for a while, but the saying was, you know, if you're not making at least one mistake a day, you're not working hard enough. And I tell people it's okay to make mistakes, as long as you learn from them, and as long as then the next step is to say, how can we prevent it from happening again? So mistakes aren't necessarily bad. But I do think, reflecting back on my younger years and my first experience moving from nursing into business, that the biggest mistake I made in my 20s was I really thought I had to do everything myself. I thought, you know, everybody was depending on me, everybody's looking at me, and in the business world, sometimes women face some different challenges than men. And it's not that men don't face challenges, but sometimes there's different challenges. And sometimes if women don't appear confident or capable or have all the answers, you know, sometimes people will say, yeah, okay, yeah, we know she couldn't do it. So early in my career, I really had I was trying to prove myself. Whoops, didn't learn how to handle the microphone. But I was always trying to prove myself, and I always felt I had to do everything, and I had to be perfect, and I had to just deliver by myself. And what I have learned over the course of my career, and this is where gray hair comes in handy. You know, finally after a few years, you get a few gray hairs. The biggest thing I've learned is I don't have to do it myself. All I have to do is have great people around me, maintain values, be clear and honest in communication, and then pull in all the talents that are around me. And that together, it sounds kind of hokey, but we are stronger together, and we are stronger as a team, and we are stronger as a community than even the most capable individual. So I think that's honestly what I've learned. And the biggest mistake, I wish I had those 10 years back in my 20s.
That's so powerful, because I'm a firm believer that we're stronger together, but we're stronger when we make mistakes. Because if we don't make mistakes, we don't change.
Right, we don't learn.
And if you don't change, the world is just going to blow right past you. So that's great. Privately, I'll share with you a couple of the other biggest mistakes that CEOs have made. I mean, we've had a CEO of a bank leverage the entire bank on a risky gig, but it paid off.
That wasn't a CEO in this room of a bank. This room, was it?
No, he's not here, and I'm not going to tell you who it is. Many of you guys know who it was. So I think you've already answered this question. The next question I wanted to ask was, what's the biggest principle that your organization lives by? And I think you've already answered that. Do you want to add any more to your people culture? Or?
I think it's people. I think it's integrity. And, yeah.
How do you build that? Because integrity is a tough thing to train an employee. How do you train that? Or do you just hire it?
Well, I think you're right. It does come to who you hire. And you're right, you can train a lot of people about insurance. You can't necessarily train people to care. And you can't necessarily train people to solve every situation. You have to have people that one of our expressions, in fact, is that, you know, our caregivers are empowered to accept responsibility to solve a problem. And that means they don't, if you call our customer service department, if you ever hear this, call me, but I don't think you ever will. If they say, I can't help you, that's not my department. Instead, you might hear someone say, I don't know the answer to that, but I will find out and I will call you back within 2 days. And then they do. And even if they don't know the answer in 2 days, they will say, I'm still researching this was very difficult, and I will call you back in another 2 days. So you hire for culture, you reinforce it with where you put your rewards, you reinforce it by modeling the behavior, and you also reinforce it if people don't live the values, and this is hard sometimes, but if people are not living the values, we will help them leave the organization. I mean, we'll certainly first try to coach and counsel and provide guidance, but if they can't live the values, no matter how technically good they are, I will say this isn't the organization for you.
And that's a hard thing for an organization to come to grips with, is that sometimes it's better for the organization and the employee to part ways. How many of you guys caught what she said when she first started that answer? I thought she was when you started your answers, it was talking about your caregivers. I thought you were talking about the doctors. She was talking about our customer service reps.
Our employees, we call them all caregivers.
Yeah, I love that concept. I may have to use that. Lois may become a caregiver. Now I'm going to bring it back to the Chamber of Commerce. You're a Chamber of Commerce, a member of the Chamber of Commerce in Salt Lake. You're a member of the Chamber of Commerce here in Idaho Falls. Why?
Well, there's a number of reasons. We actually belong to 7 or 8 chambers in the areas that we serve. And this goes back to be a couple reasons. One, we do believe it's important to be part of the community and be committed to the community. And we believe that it is important to listen to people, because the needs in Southeast Idaho, the needs in Idaho Falls are different than the needs in St. George. And it's really to listen to people. We also believe that chambers are critical. They're critical for bringing people together. They offer critical educational programs. It's a forum to discuss what are the community needs. But we think that the chambers, the community leaders, the business leaders, a chance to really hear and listen and work together as part of the community. So that's why we support them. And clearly there's opportunities for sharing and promoting and sharing information. But yeah, we really like it.
I'm so glad you feel that way, because we believe that the Chamber is a part of the community as well, and our focus is to help everyone. I don't care if you're a member of the Chamber or not. If I've got a program that'll benefit you, I want you to take advantage of it. Because if we can help the community grow, it helps everyone. I'm excited you feel that way about it. Here's a fun question. Who's your role model? And why is that person, besides Park?
Well, I thought long and hard about the role model. And I would have to say, and I'm going to ask, you may know this name. Does anybody recognize the name Gail Miller? A couple of people know Gail Miller. Larry Miller, auto dealerships, owners of the Jazz, the Utah Jazz, the Bees, the Motorsports, Megaplex. Gail Miller is an amazing, amazing woman. And I've really had this privilege to get to know her over, I would say, the last 7 or 8 years. And I first met Gail, we were both asked to be speakers, actually to a group of high school students. And it was to really encourage these high school students to continue their education after high school. And they asked Gail to speak, and they asked me to speak. And it's the first time I met Gail, it's the first time I heard her. And she talked about her life story. And she married Larry Miller. They were high school sweethearts. They got married right after high school. She commented that they really had very, very little money, and that her husband, Larry, was interested in being a baseball player. And so they did the circuit with the, I think it's like AA circuits. And she was very loyal and wanted to support her husband in this endeavor to play professional baseball. And she's telling this story, and I'm listening, and I've never heard it. And then she said after they were in Steamboat Springs, Colorado, they had 2 children. They couldn't afford to stay in a hotel room, so they were sleeping in their car. And she said that she was pregnant with their 3rd child. And she said, Larry, I've supported your dream. It's time to get a job. And I mean, I just love this woman. And then the job, the first job he could get was actually doing maintenance in an auto dealership, and he was cleaning the floors in the maintenance area. And then Larry said, well, you know, this is a good job and I can support my family now and my wife's happy. But he goes, I really like sales. I think I could be selling cars. And so he worked his way up, he was selling cars. And for those of you that maybe don't follow Gail Miller's career, her husband, who died a few years ago of a chronic illness, and he's published this in a book. But then he got into the car business, and now, I forget, maybe Park knows, but Larry Miller owns like hundreds of dealerships in 14 states. And I love basketball, by the way. I love pro basketball. When I moved from Detroit, where I was with the Henry Ford Health System, one of the first things I got to do was actually go to a jazz game. And I was like, Pistons, Jazz, Pistons. It was quite a different experience. But I have become a real fan of the Jazz. So I have watched Gail in her career. I've listened to her. I've learned from her. And at this point, she's a very wealthy woman, as one might surmise. But what I've learned from her, she is, again, driven by her values. She's driven by community service. And one of the areas where I really got to work with Gail and know her, I had the privilege of serving on the Salt Lake Community College board, and Gail was the chair of that board. And what I saw her do for education, post-high school education, and her commitment there, and then what I saw her do, she certainly doesn't have to work she works every day because she's like the chair of the board. So she works, but she doesn't have to, she really wouldn't have to work to support herself financially because she's pretty well set. But this woman who is now in her 70s has energy and passion, and she's not only working on education, she's passionate about healthcare because, again, her husband died of this chronic disease. She's passionate about addressing social issues. She tackles tough issues. She's been doing a lot of work with the homeless in Salt Lake. And so I just admire this woman so much because she's so passionate, she keeps working, and it's all in service to others. But I will also tell you, going back to this first story, she described her story as I never started out, I didn't intend to be a businesswoman. But she was called into this and forced into this through the circumstances in her family. And what I can tell you though, she is like one tough businesswoman. She has learned, she is smart, she's gotten advice from all sorts of people. And she has built a legacy for her family and a legacy for the community. Because one of the things that she did recently with the Jazz, she actually has put the basketball franchise, in a trust for 100 years for the people of the state of Utah. So this has become a part, it's an asset, it's a gift to the state. And with this trust, which, you know, she could have sold the franchise for probably some pretty big dollar signs, but she said, I want the Jazz to be in Utah, it's part of the state, it's part of the family, and it's the culture. And so I'm thinking, okay, I'm going to learn everything I can from this woman, and I'm going to support her in any way I can, but she's amazing. So she's my role model. So who knows, oh, okay, you heard of the Jazz, right? I think last time I looked, they were in 6th place in the Western Division. Yeah, you know, unless that changed. But I'm going to go see a game next week, and David and I are going to hopefully get to see some playoffs together. So do you like the Jazz? You don't have, okay, you like the Jazz. But Park, anything about the autos, did I get that about right?
Yeah, you're right. He actually started out as a parts manager.
Oh, okay. That was after he was sweeping the, okay, parts manager.
But, and just a brilliant guy. He was a wonderful leader. He just built that team, just like you do, built a team, and then use that team to buy other people, give other people the opportunity to succeed. That's how he did it.
Yeah.
Great story. I'm becoming I grew up a Seattle Supersonics fan.
Ooh, that's tough.
They don't even exist anymore, but it's taken me this long. I'm starting to like the Jazz. It's just been hard.
Yeah. It took me a little while after 2 back-to-back champions with the old bad boy Pistons. It was kind of hard, but I'm liking it now.
Yeah, I'm still a Seahawk fan, but I'm becoming a Jazz fan. So, it's interesting you mentioned advice in there. Oftentimes it's hard for leaders to find people that they can trust. So when you need advice, who do you turn to?
Does anybody go to these, you do these employee surveys that talk about, do you have a best friend at work? Have you ever heard, okay. Actually, that question to me, I really enjoy all the people I work with, but I have to say my best friend in the whole world is my husband. And he is my rock, he is the person that will always tell me the truth, and he is the person that, no matter what, it's this unconditional love and acceptance. And I would say when I really need advice, I talk to my husband. And I would never, of course, I don't talk about a specific work problem or a specific name. I don't ever breach a confidence. But when I'm really stuck and I don't know where to go, I talk to my husband. He keeps me on the right path, and he keeps me grounded. As far as business advice, I'm also really fortunate. I participate in an organization called the Alliance of Community Health Plans, and this is about 23, 24 health plans and health systems around the country that are all not-for-profit. That is one thing that also makes Select Health unique. We're a not-for-profit, wholly owned subsidiary of Intermountain. But these other 23 or 24 health plans, they're all not-for-profit. They collaborate with providers. Their focus is on community health improvement and making healthcare better and more affordable. So I have a peer group, if you will, of about 24 CEOs, and some of these names you'll know. These are like Kaiser Permanente, Scotland Light, the Health Partners out of Minneapolis, the Geisinger. There's just a number of these plans. And as peer CEOs that operate in different markets, we can talk with each other. We never talk about anti-competitive things, of course, but we can talk about industry problems, and we can talk about how to work. So my husband is my best trusted advisor, and then I have this great peer group of CEOs that are talented from around the country.
It's a good balance. That's good to hear. I'm trying to decide how to phrase this question. I guess I could just read it. The question I wrote was, how did you become involved in the Federal Reserve and what did you learn there? But I don't know if you get involved in the Federal Reserve. But how does that happen, that a nurse turned CEO is now involved with the Fed? Because the Fed kind of fascinates me, what you guys do.
Mm-hmm. Well, sometimes it's better to be lucky than smart. And I really, it comes back to being in the right place at the right time. And I first want to say, I've been now with the Federal Reserve Board and it's a Salt Lake branch, which covers Idaho and Utah and parts of Nevada. We're part of the San Francisco Federal Reserve System, which is the largest geography in the Western states, and then including Alaska and Hawaii. And this is where, you've noticed I talk to Park periodically. Park is also on the Salt Lake City branch of the Federal Reserve Board. So I've gotten to know Park over the last few years, and I've gotten to know Sharon, and it's been just delightful. But the Fed is really interesting. They have, at these regional offices, they have a 7-member board. And what I didn't know about the Federal Reserve until I started having conversations with the local executive, they have several of these around the country, and they are always seeking a mix of businesses, background, and experience. And so you have people in different industries, and at the time they had an open seat, they were actively recruiting they wanted somebody who had expertise in healthcare. They wanted somebody who could calmly explain the Affordable Care Act. without either saying it's good or it's bad, but just could say, this is what it means, this is some of the advantages, this is some of the challenges, but who could just dispassionately talk about the Affordable Care Act. But mostly they were looking for somebody with health care, and at the time they were seeking a woman because they wanted some gender diversity on the board. And they were also looking for someone who was in a CEO role. They were looking for senior leaders. And there's lots of women that are CEOs in Utah, but they also had a dollar threshold. They said, we want a woman who is a CEO of an organization that has annual revenue of more than $1 billion. And our company is about a $4 billion company. And they said, we looked all over the state. We couldn't find anybody that was a woman who could talk about the ACA, who ran a $4 billion or an over $1 billion company. You're the only person we could find. So would you consider? It was a great recruiting effort.
I feel bad for bringing this up now.
So, but again, being in the right place at the right time, and it was a coincidence. I was Robin Rockwood as the regional executive. And we met, you'll like this, Chip, we met at a Chamber of Commerce meeting. We met at the Salt Lake Chamber of Commerce. And she said, you know, I hear you're in healthcare, could I talk to you? And that's where we met, we developed a relationship. And I have to say, this 5 years for me has been extraordinary. And you asked, what have I learned? I have learned, once again, there are great people in all different industries and great people with different perspectives. But what I learned the most, I kind of, in my role and in my job, I spend many, many hours a day thinking about healthcare, morning to night. I'm focused on healthcare. And I'm sort of oblivious to what else is going on in the world. Sometimes you get that way, you get just very narrow and you're consumed. And this opportunity of working with others on the Federal Reserve Board, I love the meetings, and there are people from so many different industries. And I've worked with Park, I think we joined about the same time. And as I reflect back, I have learned things I would never have even thought about because of this diversity of industry. And I wanted to mention one of the industries, Albert Wada from Wada Farms, was on the board for a number of years with us. I learned so much about agriculture. I learned so much about potatoes. I learned so much about what it meant when there was a dock strike in the Pacific Ocean in Los Angeles, and what that did to agriculture. I would never have learned any of that without just listening intently to Albert. I learned Josh England from England Trucking was on the board. So I learned about trucking and autonomous vehicles and some of the challenges with concerns about NAFTA. I keep learning about banking and autos from Park and other things. Park is like this wealth of information. And I'm trying to think, other businesses, we've had people with retail, international. Another one of my favorite board members was Skip Oppenheimer from the Oppenheimer Company. And I know that Skip and Park have also, besides working in being experts in their field, I know they share this passion of education and are working to focus on community colleges as part of the state. So that's what I've learned. It keeps my perspective broad. It allows me to meet people that I otherwise wouldn't meet. And then it allows us, our role, by the way, at the Federal Reserve, I'm not an economist. And that's the first thing I told Robin. I said, why do you want me? I'm not an economist. And she said, no, we have plenty of economists. The Fed hires hundreds of economists and microeconomists. What they said is we need real people that are in real jobs, in real communities, to tell us what's really going on the ground level. You know, what's going on in your company, what's going on in your community, so they can test that real life feedback to what they're seeing in all of the economic models. So they really get a lot of input from us, and it's been a good education because prior to that I didn't even know what the Fed did. So it's again, it comes back to people and learning and never stopping learning.
That's Great, great. We're going to run out of time here, so I'm trying to decide when I want to make my last question. And I'm going to throw two of them at you, let you take your best shot. You can answer whichever one you want.
Oh, good.
Because I love asking people about the biggest risk they ever took. But I also like to know, given your life experience and the things you've done, and the things you've learned, would you do it differently?
I would not do it differently. Because every step along the way built on something I learned before, and every step along the way, wherever I have lived or worked, I've learned from others, and I've met so many wonderful people in my life. And certainly there's been disappointments and mistakes and hard times, but one of the things my husband keeps reminding me is, this is a long time. You know, there's highs and lows and goods and bads, but we're in this for the long haul, and it really comes back to do your best, no matter what it is, and then be grateful. I think that's the biggest thing. I am so grateful. And then with that, if you're fortunate, because I have been fortunate along the way, use that fortune to help others. So I wouldn't change too much.
We could have just had that answer and gone home early, right? Isn't that great? So we have a few minutes left. Are you game for taking questions?
Sure.
This is a rough crowd, so you never know what you're going to get. Go ahead, Lee.
Thank you for attending and giving your insight. It's just wonderful. Thank you very much.
Thank you.
What do you think is the biggest challenges facing the healthcare industry and society right now?
Oh my gosh. The question was, what are the biggest challenges facing the healthcare industry and society? I do believe the biggest challenges facing healthcare are really how to make healthcare more affordable for people. More affordable and more accessible. And some organizations are working toward that goal. Other organizations are not. They're saying, gosh, we've got a gravy train and we're riding this train and we're going to make as much money as we can and that's it. But I do think that's a real challenge. And I also think the biggest challenge in society right now is really the disparity of people, of very high income, very fortunate people and low income individuals. Because that disparity causes lots of problems. And it's not that I'm suggesting that there should be some way to equalize that, the wealth, but I think it's important to have greater opportunity for people to gain skills to come out of poverty. And one of the things I've learned, healthcare and education are related, because if you are more highly educated, and high school, community college, if you have a higher education level, and these are averages, this is not every circumstance, but you actually then have better access to jobs, and you have better access to health care. But what is striking to me is the age of death. If you have graduated from college, your life expectancy is 15 years longer than if you have not finished high school. So we're not talking about a year or two, we're talking about a 15-year difference in life expectancy. And some of this does tie back to zip codes. It depends more what zip code you live in than what your genetic code is. But the cure, like I said, the cure is not passing out money, but I believe the cure of intergenerational poverty is education. And it's early childhood education, it's education, and then it's doing whatever we can to get people educated. And this can be trade education, community college, and having those open access community colleges that will help people build skills and knowledge to then be a productive member of society. So I think that's maybe the biggest thing that I see as a societal problem. Everything else I think is a symptom, but that's why I'm so impressed by, I mentioned Gail Miller, I mentioned Park, I mentioned Skip Oppenheimer, that importance of not giving people a handout, but giving people a hand up.
In the back.
Well, Patricia, I'm going to give you a hypothetical situation. And it's really hypothetical. Let's say you were magically asked to come to the White House and then provide guidance to President Trump for about a half-hour period of time on the ACA. What would that half hour consist of in terms of the overall theme that you would provide to me?
Oh my.
I told you it was a tough crowd.
Oh my. I think that I don't know that I'd even start with talking about healthcare. And this is the hypothetical magical world, but I would rather focus on how can we get away from the very polarized, very partisan politics and the daily news cycle, and is there a way to start to bring people back together to remember why they were elected to office and to say, stop all this, and there's just madness everywhere. And I guess if we're going to dream big, it would be to say, how can we get people to come back and work together to serve the constituents that they're representing and find long-term solutions. And that's both in healthcare and immigration and so many issues. I know that's maybe a pipe dream, but the big picture would be to say, stop positioning and start working for affordability and access, and that's the best advice I could give you.
Great answer. Go ahead.
So, Patricia, managing the rising cost of healthcare has been a problem that's eluded an answer for corporate America as well as the government for a long time.
Yes.
But listening to you, it sounds like Select Health has found some tools in their toolbox in addition to good customer service and culture. What are you using to stabilize those rates, and how can that benefit our community here?
Thank you for that question. I'm going to share now, okay, this is a deeply held actuarial secret. Okay, you ready for this? And I'm just going to tell you guys, it's a secret. Healthy people cost less than sick people. Okay? Okay? And this does come back to this idea of our mission is to help people live the healthiest lives possible. And there's lots of different tactics that can be taken with your benefit design and things like that, but fundamentally, it starts with how can we build healthier communities, how can we build healthier workplaces, and then how, when people do get sick, because a lot of times you get something, it's outside of your control. But when people do get sick, how can we take the best care of them and their families at the best, lowest cost and the best outcome? But I think we need to, and what we have done at Select Health, and I mentioned these other not-for-profit health plans around the country, we're all kind of working in the same direction. How can we first help our communities be healthy? How do we put tools in the hands of the workplace so that people at work can be healthy? And some of this, it does involve lifestyle changes, and some of what I'll say might not be well received, but I'll say it anyway. I mean, things like we know that using tobacco and smoking causes problems, and the cost and the health impacts are real. So having a tobacco-free workplace, having a workplace that serves healthy food in the cafeteria, having a workplace that maybe has walking trails. And one of the things we do at Select Health, and it's in David's team, they actually hold walking meetings. We're across from a park, and it's about a mile around the park. They will go out and have a meeting while they're walking. We have an on-site gym at our workplace. And you know, it's accessible, but creating a culture of health in the workplace, creating a culture of health in the schools, and so many of the schools have cut out their physical education programs. There's budget cuts, and so they don't have FIA teachers, so they expect the geography teacher to supervise a playground. So one of the things that we've done, we provide schools across Utah, and we've done some in Idaho, with simple equipment, simple, you know, jump ropes and soccer balls. And we have a program that's called Step Express. And it's a program, and it's a curriculum for teachers. These teachers who are not gym teachers, who are asked to do, to promote health. We've created a curriculum that got school board approval, and they teach kids in the lower grades about healthy eating. And then we provide, and this is not overly costly to provide balls and soccer balls, but it's promoting activity in the schools, because it does come down to healthy activity, avoid the toxins, and really healthy diet. So we do a lot with the farmers markets, because again, it supports farmers and it supports getting healthy food to people. So it's really about building health. And then we do have these other tools that I mentioned. We have a lot of computer-assisted tools. We have a health and wellness program people can use a lot on their home computer. We've got digital coaching. We'll come to work sites and we'll help people get flu shots, and we'll help people set up some of these programs. And this, and there's David, we have seen the employer groups who have adopted some of these worksite health and wellness. In fact, we should get that video clip up from Waterford schools. They've adopted this. The teachers, you know, work on stairs, and they've kept their insurance premium flat for a couple of years now. But again, it's the culture of community, schools, workplace, religious organizations, and then taking great care of people when they do get, unfortunately, sick or injured.
There was an article in the local paper here in the last week about some doctors and a couple of hospitals that are trying to address the opioid crisis. I was talking with an attorney yesterday he's had clients who are affected by this, and there's a growing concern, throughout society. How do you see Select Health being able to help doctors or hospitals or the community at large deal with this crisis?
Yes. Did everybody hear the question, the opioids, and this is a national problem, and states in the West have had higher rates of opioid use, substance abuse, higher rates of suicide. This is a terribly difficult and challenging problem. But one of the things that we're doing as part of the Intermountain system and with our community partners, last year, the first phase was there's two problems, and a lot of the reason behind opioids, there's a lot of reasons behind it, but one of the biggest reasons is chronic pain. And so one of the things that we're doing, and I was just in a meeting yesterday, we're really setting up within Intermountain some comprehensive pain management programs, multidisciplinary pain management. Because people don't typically say, well, I'd like to end up being addicted to drugs, but they have real pain. So treating that root cause, that's one issue, because the largest opioid use is really related to chronic pain. And that's something we're kind of starting to tackle now. But what we did working with the community and Intermountain over the last couple of years, we have also worked with physicians on their prescribing pattern. You might have acute pain, short-term pain, maybe after you have, say, surgery, and you're in pain, and you may need some pain pills for a couple of days. But what has happened across the country, the prescribing patterns, the way that drug companies have promoted use of opioids, they early convinced physicians that opioids were non-addictive pain medicine. And doctors were also they wanted their patients not to have pain. So doctors have become acculturated to prescribing large quantities of opioids after acute events, surgeries, like maybe 30, 60, 90 tablets, when all you need are maybe 2 or 3 to get you through that first 12 or 14 hours. So we worked with all of our physicians and Intermountain physician leaders, and we had a goal of reducing acute opioid prescribing by 40%. We wanted to take out 40% of these extra pills. And we did not quite reach the goal. We got into the 30s. But that meant, if I can remember now, how many pills? That was like 3 million pills that weren't prescribed. And so we've been tackling the acute prescribing, and we've set up a lot of bins to collect. You know, anybody ever have unused pills sitting at home? We also worked with the community to take these unused pills, and a lot of them were opioids. We collected over 2 tons of unused pills. And whether it's an opioid or a blood pressure medicine, if that gets in the hands of a child, that's not a good thing. So we've collected a lot of unused pills. We've been tackling the prescribing pattern, and now the next phase is to try to tackle the problem with pain. So what we would do in this community is, again, some of those similar tactics, work with community organizations, work with provider systems, and try to set up better methods to treat pain and better methods to control the amount of opioids that are just out there.
Let's take one last question, Mike.
Hi, so you have a lot of organizational leadership experience, so I'm curious, it's very transferable both within healthcare and to other industries. I'm curious how you mentor emerging and growing leaders and how Select Health takes an approach to leadership.
Wow, great. Thank you for that question. You know, I started this story by talking about in my early career, it was sort of all about me and I wanted to prove myself and my competency. Well, at this phase of my career, which is, you know, I've had a good long career and I'm at the end of my career, and the thing that is most important to me right now is actually building the next generation of leaders, and how do we build and how do we mentor. And I am so pleased to say that at our organization and within Intermountain, there's a lot of formal leadership development. But what we've also done, we've set up some very specific mentoring programs, and this has been very enriching for our executives, the mentors, and it's not just limited to the executives, but other mid-level managers. So it's enriching for them, and it's enriching for the mentees. So we have active mentoring, we have formal leadership development. We have, as might not surprise many of the women in the audience, we also have a very active women in leadership program. We bring in women leaders, and we talk about those unique challenges that women may face in the workplace. And we encourage our people to go from one department to another, and because a lot of times you don't go straight up. You go around and you build skills, and we give people opportunities, and we encourage people to take on these stretch assignments, and we'll coach. And this is another place where you said, it's even okay not to be perfect and make a mistake. But for people that know, okay, they don't have to be perfect, they just have to be committed and live the values. And I think that's why when we look at our employee, our caregiver employee engagement skills and why our workplace ranks so high, I always tell people, we take care of our customers first, but we can't take care of our customers unless we take care of our caregivers, and we have to take care of each other. So those are some of the programs, and they've just been so well received.
Perfect. Well, Pat, thank you so much for being here. I'm very confident you all see a little bit about what I saw in her that first meeting that I had with her. And I'm so glad that she was willing to come and share her time and their talents and their expertise with us, because I think we're all going to be, our whole community is going to be better off because of your experiences. So thank you once again for being here.
Thank you for coming. Thank you.